Hello everyone, this is Dr. Al and another Plap 2 Jewels for you. So, someone asked me a question. They said, are all the stations about medicine just like what you've been talking about? Absolutely not. You need to keep a very broad mind. You might be asked about anything, and I do mean anything: gynae, peds, surgery, counseling, absolutely anything. Now, I know that the first three honestly speak for themselves, but in the sense of counseling, I'm going to give you an example what that might mean. So, this is completely hypothetical from the top of my mind. This should not reflect anything about the exam, but it could go something like you're in FY2 in hospital in respiratory department. Your patient was admitted with chest infection. Now you need to go and have a discussion with the patient to convince them to quit smoking. As simple as that. So how you approach this station? You start by, "Hello, my name is 123." You introduce, of course. Then, do you mind telling me what is it you know about your hospital admission? First thing always is to check how much the patient knows. So the patient might go like, "Oh, I know I was admitted with chest infection. I got some antibiotics. Da 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 da." I don't know what they might say. I'm just giving you hypothetical sentences here. Now you want to dive in. So before you dive in, you want to find something the patient has that is caused by smoking. Or if the patient does not have anything, let's say the patient does not have COPD, the patient does not have bladder cancer, the patient does not have lung cancer, the patient does not have what else? Asthma, which is triggered by smoking. Then you start by, okay, let me walk you through. I've been told, my registrar, my senior nurse told me to come and talk to you about the harmful effect of smoking. I don't know if you've ever had this discussion with anyone before, but is it okay if I talk to you about it? Again, don't be surprised if the patient in the exam said no. If the patient in the exam said no, you have to convince them that this is for your benefit, we have to talk about it. The best part about counseling is that there is no structure to follow. Your task is to have a discussion, a valid discussion about the harmful effect of smoking. Hence, you will have this. You want to find if the patient has COPD, explain how much they know about COPD, explain how the relationship between smoking and COPD, advice against smoking, refer, give solution. Don't just give random topics. I can offer you some nicotine replacement therapy. I can refer you to smoking cessation clinic, and hence you'll get to it. There's no structure. You just have to remember to be human.